Dr. Brownstein, my new friend, welcome back to the podcast. Thank you for making time to have another conversation with me.
Well, thank you for having me, Shemaine.
This one, well, the last one was very popular. A lot of people in my neck of the wood, at least, really enjoyed our conversation, which I'm surprised because you got me so early on a Saturday morning. I don't even know how I performed, but it was great nonetheless. So, in this one, as I mentioned to you, I want to discuss the miracle of natural hormones and really just kind of let's focus on that today and your approach to it. Not everyone else's approach, your approach. So, you have your book, which I have the older version, and I will try get my hands on the new one. This was the only one available in Canada, but I'll try get the new one. And this one is the miracle of natural hormones. Lately, we hear a lot of talk about bioidentical hormones. Nobody really refers to them as natural hormones at all, but you refer to them as natural hormones. So, what are natural hormones in your
Well,
words?
in my thought, natural hormones are just a different term for bioidentical hormones, and
Mhm.
uh, I think natural hormones is a little easier term to gather. But natural, well, let's call them natural bioidentical hormones, and we got everything covered.
Yeah.
But natural hormones are direct mimics of our own hormones, and if we think about the human body. A hormone is produced in an endocrine gland, and the glands include the thyroid, the ovaries, the uterus, the breast, prostate, pancreas, salivary glands. But these glands produce hormones that are released into the bloodstream. And once in the bloodstream, they are taken up by different cells of the body and they bind to the receptors in the cells.
Mhm.
So you can sort of think about that like a lock and a key. The key would be the hormone sort of circulating through the bloodstream. It goes inside the cell and then it looks for the lock.
Mhm.
And once that key fits in the lock perfectly, you you a lock and a key in a house would be the key would turn the lock and you open the door and come in the house.
Mhm.
But in the cell, the key would or the hormone would bind to its receptor, like the key binding to the lock, and then the turning of the key, or in this case, would be the hormone producing and the receptor binding to it creates a reaction,
Mhm.
and the reaction is a protein is formed.
Mhm.
So, for example, in the thyroid gland, thyroid hormone is formed, and um, thyroid hormone mostly in the thyroid gland, which sits in the lower part of our neck, forms or produces T4 or alpha-roxin.
Mhm.
The 4 refers to 4 iodine atoms attached to one thyroglobulin molecule. That T4 molecule gets released into the bloodstream. It goes inside the cell where it's converted into T3 by an enzyme called deiodinase, which cleaves one iodine atom off the T4. And now we have T3, which looks for its receptor in the cell. When T3 binds to that receptor in a perfect fit, because that's how we were designed for this reaction to happen, something happens at that point. A protein is formed.
Mhm.
Um, Energy is formed, and
Yeah.
heat is formed. So people who have enough thyroid hormone have enough heat. Their skin is soft, their hair is strong, and things like that. So it's a
Everything's
pretty
good.
everything's good.
Mhm.
It's a pretty cool mechanism, pretty cool concept. And I wrote that book. You showed me the cover of that book, and I said to you, "Oh, that's an old cover. I got a third edition of that book out." Uh, and I remember working on that cover, and that was the old days. That was 30
I
years
think it
ago.
says 1999. Is that right?
I wrote that book in 1998, and I remember working on that cover, and that was the olden days of writing a book where you typed the book out,
Yeah.
formatted, and then you printed it out on a printer, and you take those papers into an actual book publisher,
Yeah.
and they would take pictures of the pages and then get them into a book, and it was a fun time to
Yeah.
do that.
Yeah. The
And
good old days.
that was the first book that I wrote, and I wrote that because I had started using natural hormones about 5 years previous to that. And I kept coming home telling my wife stories at dinner of patients who were feeling better on them, and just I kept repeating the same line over and over. These things are a miracle. How come we didn't learn this in med school?
Hmm.
When I went to write the book, the title was already done before I wrote the book,
Yeah.
uh, and there was nothing I would change about, you know, maybe one or two words in that book that I would change from 30 years ago, but it's all true, and it's, balancing the hormonal system is still one of the best things I do in my practice.
I told you I've read it, but I'm going to take it on the plane with me and read it again because when I get attached to a book like Dr. O'Barnes one, I'll keep reading it and reading it and reading it. And so, like in this, you say a hormone is a chemical substance provided in the body by a gland and has a specific regulatory effect on the activity of the body. So, with the lock and key analogy, then, how would you describe a synthetic hormone?
So in med school, we weren't trained on the difference between a synthetic hormone and a bioidentical natural hormone.
Mm,
And I really didn't know there was a difference between them when I graduated medical school. I think you and I talked about my history. I went to med school to be a family doctor. I wasn't holistically inclined, and I bought everything I was taught in medical school and in my residency, and I came out practicing conventional medicine as I was taught in med school. I never took a vitamin before then. I never thought differently, and I was in lockstep with what I was taught. Um, so when I started using natural hormones, word quickly spread. And remember, that was the 1990s,
mm,
that there's a actual medical doctor who's willing to prescribe bioidentical hormones and natural hormones.
yeah.
So I remember getting this call from this chiropractor saying, "Hey, do you prescribe progesterone?"
Mm,
And at that point, my first hormone that I did was natural thyroid hormone.
mm,
But um, I said, "Yeah, I prescribe Provera." And she paused and she goes, "Well, that's not progesterone." And I said, that's what I learned in medical school.
yeah.
And she said, "Well, it's not progesterone." And she referred me to a book. And
She schooled you.
I pulled some articles after that, and I realized I got to go back to school and I got to relearn this stuff. And I studied every hormone one at a time. And in that book, in the chapters of the book, I described the hormones one at a time, and
Hmm.
pretty much in order that's how I started prescribing them as I learned about them. And you know, I can tell you without a doubt that Provera is not progesterone. And, in the case of progesterone, which is produced in the ovaries and the adrenal glands, progesterone, when it gets released into the bloodstream, gets taken up by the cells of the body and binds to its progesterone receptor. What happens at that point? A protein is formed, a chemical reaction occurs. In the bones, for example, when progesterone binds to the bones, it stimulates the bone remodeling process, so you get stronger, more firm bones.
Yeah.
Uh, Progesterone helps to get rid of old and injured bones.
Hmm.
Now, Provera, which is, and I have the two pictures in my book for you, but
In Appendix A, it says.
progesterone, as I said earlier, it's a lock and a key method. You need the perfect key to fit on the lock to get the right
Mm,
reaction. Progesterone binding to progesterone receptors is that perfect fit.
hmm.
It's a little bit different. There's a carboxyl group that's added to progesterone to make it Provera. Who added that? Well, Big Pharma added that. And why did they add that? Because they changed the perfect molecule progesterone into Provera. Why would anyone do that? If you're going to prescribe progesterone for somebody for whatever reason, we already know what it is.
Hmm.
Prescribe it. We have receptors for it. We know how it's going to interact in the body. We know the safety of it. And if there's problems with it, we know when the problems will occur because this is how humans were formed,
Yeah.
to utilize progesterone. So the reason Big Pharma changes progesterone into Provera, so they take, let's say this is the progesterone molecule and this is the receptor. So progesterone binds perfectly into that receptor, and then the bones are stronger. The bones
Hmm.
are healthier. Provera looks like this. It has a carboxyl group attached to it, so it's a little different.
Hmm.
It'll still bind to this receptor, But now this Provera is considered a foreign substance to the body.
Mhm.
The receptor's never seen it before. The body's never seen it before. The body doesn't know what to do with this. Provera binds much tighter than progesterone to this receptor and stays much longer.
Mhm.
And the chemical reaction's different when it binds there.
Mhm.
You don't get stronger bones when Provera binds to the progesterone receptor in the bones. You get weaker bones. One dose of Depo-Provera, an injectable form of synthetic progesterone, can cause irreversible osteoporosis. Multiple doses of Provera are known to cause osteoporosis. There's studies that link Provera use with breast cancer. There's zero studies that link progesterone use with breast cancer. In
Mhm.
fact, probably has progesterone has anti-cancer properties to it in many studies.
Mhm.
Provera causes blood clots. Progesterone does not cause blood clots. The worst side effects with progesterone that I've seen in my practice is occasionally PMS and moodiness and irritability, um, maybe sore breasts. It's very rare. And if it does, you just lower the dose or you stop it. This I don't use Provera,
Mhm.
but I've read the articles on it, and there's a black box warning on Provera because it's a dangerous substance for the female body. Yet Provera is routinely prescribed for young women for birth control, in the form of Depo-Provera.
Mhm.
It's Provera derivatives are found in many of the birth control pills, and birth control pills have been shown to cause an increased risk of breast cancer. Breast cancer affects 1 in 7 women in both our countries.
Mhm.
And this rising, this you know this unacceptable breast cancer risk in our countries is being driven in large part iatrogenically. It's from the use of all these synthetic progesterone. I sort of asked the question earlier, why would a company take this perfect molecule, progesterone, which fits perfectly into this receptor, and change it and add a carboxyl group to it and totally change the structure of it? Why would they do that? Well, do you have
Because
any, do you
they
have,
don't really care about our health. Could that be it?
well, I'll give you I think a more cogent reason why they do it. They do it because they make more money. So you can't patent natural substances.
Hmm.
You cannot patent vitamin C. You can't patent vitamin E. You
Aspirin.
can't
Hmm.
you can't patent progesterone,
Hmm.
but you can patent Provera. So they put progesterone, in the lab they tinker with these natural things to put methyl groups and carboxyl groups on them to change them, and then they'll still bind to the receptor in the body, and let's see what happens is kind of how it goes.
Hmm.
And now they can patent Provera, and they can make millions, billions and trillions of dollars because they'll have a exclusive patent for a number of years.
Hmm.
So Provera is the most widely prescribed form of progesterone. Now that may have changed. Women aren't in the dark anymore. The internet has helped with that, and people are able to search things, and you know people are able to read things and come to their own conclusion. And people are able to see the diagram in my book showing the difference of progesterone and Provera. And when I make that discussion of binding to the receptor, why would you want a foreign substance binding the receptor? The half-life of progesterone is a very short period of time. It's in the book. I don't have it. I believe it's 15, 30 minutes, something like that.
Hmm.
The half-life of Provera is a long period. We don't know because the studies haven't been done, but it's a long period of time. It's days to weeks,
Hmm.
uh, that it
Well,
just
we know the side effects are long.
hangs around binding to that receptor, and it doesn't get loose because the body doesn't know what to do with it. And that holds true with all synthetic hormones. And my feeling is all synthetic hormones should be pulled from the market if there's a natural hormone or a natural, same thing, just using different terminology, a natural bioidentical hormone available.
Hmm. I still speak to women who are using the depot shot, and then more commonly, I will hear um, synthetic, more commonly referred to as progestins, which a lot of women know, especially in the birth control. Their doctors will convince them that progestins are progesterone and they're the same, and they're not.
Doctors are
But
convincing them, Shemaine, because they don't know.
yeah.
Just as I didn't know back in the day, and they're not. And I talked to you about the side effects. It's a progesterones are dangerous substances that should not be on the market, should not be available for any living being to use when there's a natural bioidentical form available and it's progesterone.
And we're still giving them though to our teenage girls, but m more commonly now, women in perimenopause who are asking for help, they're getting put on synthetic birth control instead of the first line of treatment, which you will probably agree should be progesterone therapy, bioidentical progesterone therapy.
Agree.
In your book, I found it interesting that, which is awesome, that you cut up the chapters into each specific hormone. So you got thyroid, DHEA, progesterone, and the downstream would make sense to me. But what I found curious was you put pregnenolone at the bottom. Why did you put that there when really it's cholesterol pregnenolone? That was curious to me.
So when I wrote that, when I started using hormones, recall from our first interview that I came out of med school and residency, a conventional doctor, not doing anything holistically. I
Mhm,
didn't grow up in a I didn't grow up in a holistic household. Didn't take a vitamin in my life. And then my dad was really sick with heart disease for 20 plus years. And around 6 months into my practice of conventional medicine, I realized this is not for me. This is not good. It's not fun. I'm not helping people, and I can't do it. And I ended up, I'm giving the short version, the longer version's in our previous interview,
mhm,
but I ended up from the help of a patient who encouraged me to look outside of the regular method and see his chiropractor. And this chiropractor, Dr. Robert Radke, who gave me a book, Healing with Nutrition, Dr. Radke taught me about looking at the biochemical pathways and how do we support human physiology and human biochemistry. Well, in the case of hormones, we support human hormone physiology and biochemistry by using natural hormones to bind naturally to the receptors that are already there
mhm.
to get the reaction that you are trying to facilitate. Um, so I'm in the weeds right now. What was your question to me?
Why did you put pregnenolone at the bottom when it is the
Well,
top of the
well,
scale in converting?
the first hormone I used, the first two natural hormones I used in my dad were natural testosterone and natural thyroid hormone. And my dad had a 20 plus year history of continual angina or chest pain. He was on 12 medications for hypertension, heart disease, and diabetes. He was going to die at any moment. And I check a testosterone level and his thyroid levels, which testosterone level was below detectable limits near zero. His thyroid levels were in the reference range, but in the lower part of the reference range. I put him on two natural hormones. It was natural testosterone and natural thyroid hormone. And within 7 days, his 20-year history of angina melted away, never to return. Within 30 days, his cholesterol stuck in the 300s on medication, fell below 200 without changing any bad dietary habits.
Hmm.
He looked from pale and pasty to pink and healthy. He he started to do things again. He couldn't do anything because he would just get chest pain.
Hmm.
And he had bypass surgeries and angioplasties, and it would help for a short period of time, and then things would come back. So before this, I was waiting for the phone call that he died. And when I saw the changes in him in 30 days, I decided I was going to leave the practice I was in and open my own holistic practice, even though I didn't know what the heck it was. Um, but every person got a hormonal evaluation and a nutritional evaluation from that moment on, from treating my dad. And I really focused on the hormonal stuff first. So I decided I got to relearn hormones. So I started studying hormones. And the first one I studied was thyroid, since he had such a response. And then I went to the adrenal and sex hormones, and testosterone was there. Now, testosterone's sort of in the middle of the pathway there. And as you look up in the pathway, there's DHEA, there's pregnenolone above that, there's cholesterol above that. Well, I decided that I was going to look at this whole adrenal sex hormone pathway and study each hormone individually till I knew them inside and out, forward and backwards.
Hmm.
And I started to, if someone wrote a book about whatever, DHEA, pregnenolone, didn't matter, any of them, progesterone, estrogen, I bought it. If there were articles, I was getting them. And that point in my career, I was on faculty at Wayne State University, and I could get library access, and I got
Mhm.
a lot of articles sent to me, and I was going to conferences and flying all over to any conference was had any of this information I was at. Um, and so as I started studying that pathway, the first thing that struck me was cholesterol is the top of that pathway. Um, and if you're using a drug to block cholesterol production like my dad was, what the hell is that going to do to all the hormones produced downstream from cholesterol? Well,
Mhm.
it doesn't. You don't need to go to med school to figure that one out. If you're going to block the substrate at the top of the pathway, these hormones down here are not going to get enough
Mhm.
substrate to be made, and they're all going to go down.
Mhm.
And in my dad's case, when I looked at that pathway and saw all those hormones, I started checking all his levels. And I always refer to my dad as my first patient and my best patient.
Mhm.
He, didn't, he never questioned me. He always took whatever I gave him. It was interesting, my dad, we didn't question anything. We never questioned anything in medicine in
Mhm.
his house back then. We just went to the doctor when we were sick. We took whatever they took. So here I was sort of deviating. I call him up and I say, "Hey, Dad, I'm going to leave the practice." And he's like, "What do you mean you're going to leave the practice?" I'm like, "Yeah, I'm going to form my own practice. How are you going to do that?" I'm like, I already told the partners and I'm going to look for an office space and do this." He goes, "You got a baby." I mean, Haley was my first Haley was Dr. Haley now working with me
Yeah.
was at any moment at that time. And I said, I know what I got. And he goes, well, how are you going to feed your family? And I'm like, I'm going to make it work. If I have to, I'll work in the emergency room at nights and,
Yeah.
and which I did. Um, and he said, well, they're going to make you a partner. Well, you can't leave that. And I didn't fight with my dad much. We got in a big fight. I was really upset. And, um, I said to him, look, I can't do what I'm doing in medicine. I can't, I don't want to be a partner there.
Mhm.
And the partners tried to keep me because I liked them and they liked me, but I just wasn't going to work.
Yeah.
I needed my own office. And so, and I said, I'm doing this because of how you have responded, so well.
Mhm.
And, then he kind of settled down and, um, you know,
Basically, this is your fault.
yeah, this is right because you got better.
Yeah.
Um, so, um, So I started studying each of the hormones in those path. Well, I started looking at cholesterol and I'm like, statins. Now, all these cholesterol lowering medications, my dad was on them. And, um, when you study the hormones and you see each of the effects of the hormones in the body has to do with inflammation and heart attacks and heart disease. And all these effects are positive on the body, lowering inflammation, lowering atherosclerosis,
Mhm.
lowering risk of heart disease for DHEA, pregnenolone, testosterone, progesterone. Um, and if you're going to lower cholesterol levels, you're going to lower the production of these hormones. So how can statin drugs be helping this? They can't. So
Mhm.
I see the ads out there. I remember the ads, and I wrote in my statin book. The looking to see if I have my stat. I don't have any of my books handy. I should have got them out before I did this, but um, I wrote the statin disaster, and so I was looking at the articles on the statin drugs, and they're all saying 30 to 50% reduction in heart disease if you take a statin drug. Well, if I'm going to study biochemistry and I'm going to look at the human biochemical pathways, and I see the statin drugs work by poisoning an enzyme called HMG-CoA reductase, which poisons the enzyme, the rate-limiting enzyme that makes cholesterol in the body, and which means cholesterol levels are going to drop. Well, everything produced downstream from cholesterol is going to drop too. That includes testosterone, progesterone, DHA, pregnenolone, all these hormones that are vital to so many facets of the body, and particularly with the heart. Um, how can statins lower the risk of heart disease? It didn't make sense to me. So yet I'm seeing 30 to 50% reduction in all these newspaper ads and magazine ads and articles that are out
Mhm.
there. So another thing I had to learn at the time was statistics. So to get into med school, you had to take statistics. I took statistics at University of Michigan. I know you're from Canada, but this shirt signifies the University of Michigan.
I'm
The reigning,
actually from Ireland, but yeah.
I know about the University of Michigan. Everybody knows about the University of Michigan. The reigning undefeated national champions in football in the world right now.
Yeah.
So, um, I took statistics, got an A. I'm good with numbers. I've always been decent with numbers. And then in med school, you take the same class again, got another A. And I think I'm king of statistics. I know statistics. I'm good with
Mhm.
numbers. Well, I'm looking at these articles on statin drugs, and they're saying 30 to 50% effective, or 30 to 50% reduction in heart attacks if you take a statin drug. And I'm like, it can't be true.
Yeah.
Just can't be. It doesn't make biochemical sense. How did they do it? How did they manipulate these numbers? So I had to go back to, I remember I bought Statistics for Idiots, and went to the bookstore when they had bookstores at that time. And I just started studying the numbers. And then I finally figured out here's how they're doing it. I wrote about this in my statin book. And so the long-winded story to say we shouldn't be taking, if you want balanced hormones, you can't have balanced hormones taking a medication that's going to poison the production of cholesterol in the body.
Mm.
So, another little sidebar is, my dad was he was producing a lot of cholesterol because he was on medication to try and lower it, but my dad didn't eat well. He smoked, way overweight, um,
Plus, he
and
had the thyroid issues.
thyroid issues, and he was producing a lot of cholesterol because cholesterol has anti-inflammatory effects to it. And perhaps in his case, the cholesterol was trying to be funneled from the top of that funnel down to make more hormones because he wasn't making hormones because
Was trying to help him and keep him alive.
the hormones were such a mess because he was nutritionally deficient and he was eating bad food, he was smoking, and he was overweight.
Mm.
So he couldn't make his hormones, yet the body was trying to force this through producing more cholesterol.
Mm.
The worst thing you could do in that situation is do a drug that chemically blocks the production of cholesterol and not fix the problem below it.
Hmm.
So anyways, once I figured that out and I explained those statistics in the statin book. So instead of 30 to 50% effective at lowering heart attacks with statin drugs, they're actually 1% or so for most people,
It's not even
meaning
worth it.
they're 99% ineffective, and then all these side effects, when you lower cholesterol too much. But
Still
so
one of the most prescribed drugs out there, though.
40% of Americans are on that drug, and I think it should be taken off the market. Um, so I started studying each of those hormones, pregnenolone, DHEA, progesterone, and as I started, I used one hormone at a time, and as I learned about it, I would learn how to test for it, learn how to follow it, learn positives and negatives of each of the hormones, and try it. And each hormone I added, people benefited from. There were hardly any negative effects, and if there were negative effects, they were minimal negative effects that were adjusted by either adjusting the levels of hormones or whatever. It wasn't much. There was nothing, no really bad side effects from using it, and the negative effects were so few and far between. It was I call blue moon side effects. So the reason I put pregnenolone last, and there was a reason for that. You're the first one to ever ask me that question, was because of all those hormones. DHEA, progesterone, estrogen, testosterone, um, all those hormones in that adrenal gonadal pathway, pregnenolone provides the least clinical benefits. So you can put people on pregnenolone. Some feel better. There are people that feel better, but some can't tell.
Mhm.
A lot of people can't tell. However, you put people on DHEA, more people can tell they're on DHEA because they get better libido, better energy. They feel more alive. You put people on testosterone, and I'm talking men and women for all these. You put people on testosterone, they feel alive. They get
Mhm.
libido up, their muscles get better. You put men and women on progesterone, their again, libido goes up. They sleep better. Their irritability goes down. Progesterone. You put women on estrogen, um, who are deficient in estrogen, their skin's better, their hair's better, their brain is better, their body is better, their libido is better. They're happier. Um, but pregnenolone, although there's almost no negative effects with pregnenolone, you just see the least clinical benefit with pregnenolone. And That was the only reason I chose to do it last on there. And the other thing with pregnenolone, I think because it was the least clinical benefit, um, even though the body produces huge amounts of pregnenolone, there weren't as many research articles on pregnenolone than DHEA and progesterone and estrogen and testosterone than the
Mhm.
rest of them. Um, Now, the one thing with pregnenolone after the age of 50, the highest concentration of pregnenolone in the human body is in the brain. And I do see pregnenolone really helping facilitating brain function and brain activity and brain energy production in those older than 50, and particularly those who are fatigued or those who are feeling, memory decline or starting an early process of memory decline. Pregnenolone can make a huge difference if it started early in their course.
Yeah, because it converts to allopregnanolone in the brain, doesn't it? And helps with sleep.
So progesterone helps with sleep. So does pregnenolone. Progesterone helps with sleep more than pregnenolone.
Mhm.
Um, and pregnenolone, the biggest effect I see in patients is that just sharper brain. And if they have brain fog, um, they're not thinking clearly, pregnenolone just makes a huge difference.
I tried pregnenolone at the start of this year. I did not respond well to it, and I've gotten some different opinions, but now you've given me something else to think about. So at the time when I tried it, I within a day or two, I gained 8 pounds of fluid on the scale. I got swollen breasts, tender breasts, which I never ever get, not even in PMS. I had amazing sleeps, but I generally sleep great in anyway. But my sleeps I was like so fatigued the next day. I remember doing a dead hang in the gym, if you know what a dead hang is, and I started to fall asleep doing a dead hang. I was like, this is not normal. And my cravings were off the chart. So I assumed, well, maybe I'm pushing it down the wrong pathway and I'm converting more to estrogen and I'm estrogen sensitive. And then I don't know if you know Carol Peterson, she's a compounding pharmacist. She gave me an opinion that maybe the pregnenolone was stimulating some sort of estrogen kickback. But I've been also using progesterone for about 2 years. But now you're making me think that maybe I already have an abundance of pregnenolone because I'm still young, eat well, sleep well, that it was just too much then for my system.
So I use out of all the over the age of 50, most of my patients are in pregnenolone. Younger than age 40, not as many are in pregnenolone because I check levels. And my guess is you're still producing enough pregnenolone. And, and also how much did you use to get that effect?
I think I started 50 milligrams, and my goal was just to help me sleep better. I think I was going through a period where I wasn't having great sleep.
Yeah, that's a lot for your age. That's a lot of pregnenolone. I wouldn't have used that dose.
Well, lesson learned. And now you have another case study if you ever write a book on pregnenolone. So with your dad, I'm curious, did you ever look into the estrogen connection with your dad in regards to his angina and even his thyroid issues, like his issues before you put him on thyroid and testosterone? Did you ever see if there was a connection there with maybe he was producing excess estrogen because again, he didn't have a great diet or lifestyle or whatever?
So when I my dad got better on the thyroid and testosterone, very quickly I checked all his hormones. They were all low, below cholesterol. They were all suboptimal. Um, Now men don't produce a lot of estrogen, but we produce some estrogen, and um, he was low in every one of them. So what I found with my dad, and what I found, found over 30 years is when you use hormones, natural hormones, if you're just going to just try and facilitate the whole pathway by giving him pregnenolone,
Mhm.
maybe 50 milligrams, 100 milligrams or something like that. But if you use pregnenolone with DHEA, with progesterone, with testosterone, with estrogen in a woman, with thyroid hormone, when they need, whatever they need for all of them. But if you use them in combination, you can use much lower doses than when you use them individually. And there's a synergistic effect in combination. So one plus one, in hormone use in people, bioidentical hormone use isn't three. It's 5, 6, 10, 20, 30, 50, 100, whatever it is. There's a synergistic effect where they're much better to be used in combination, small dosing, than they are in large doses individually. And I wrote about that in my book.
Have you had to use or even had a concern with converting testosterone to estrogen? Have you had to use aromatase blockers with any of your patients?
So testosterone can, in men and women, testosterone can aromatize into estradiol. And there's an enzyme called aromatase that does that. Um, as in men, as we get older, we aromatase gets more activated and we produce more estrogen than, you know, when we were
At
younger.
what age is that in men? Does it start to kind of kick up?
It kicks up in men, it's the same thing with women. I call it menopause, or, menopause for women, menopause for men. And it kicks up around then. And it's worsened with obesity. It's worsened with a bad diet. It's
Mhm,
worsened with cigarette smoke. Anything that inflames the body and, makes the body unhealthy seems to increase the activity of aromatase enzyme.
mhm,
So number one, before relying on an aromatase inhibitor, it's clean up the diet, exercise, um, drink water, do the basic stuff.
mhm,
And I don't use a lot of aromatase inhibitor. I mean, I have a couple of patients in 30 plus years of thousands of patients that I have an aromatase inhibitor.
mhm,
Uh, and there are natural aromatase. Um, they're not inhibitors, but they're regulators where they'll slow down the ability of that enzyme. Zinc is something. So I basically check everyone's zinc level. This is where you look at the biochemical pathways and you see what, what can facilitate and what can inhibit aromatase enzyme. So adequate zinc levels can slow down that pathway, and too low of zinc levels, the pathway speeds up and you make more estrogen. Pycnogenols made from pine bark and grape seeds can also help facilitate the aromatase enzyme. There
But
are
these
other
are
herbs
also anti-inflammatories.
there, and there's other herbal things that do that, but I found that if people can just get their health in better shape, most times they don't need aromatase, enzyme, inhibitors, and I only have a few people on them.
Some of my clients make fun of me because I sound like a broken record. All I talk about is inflammation, inflammation, keep your inflammation down. No, that's too inflammatory. And they're like, oh, so inflammation just causes everything? Yeah, yeah, pretty much.
I agree with you. Yep, it does. So, you know, inflammation, let me use this. Inflammation, like a teeter-totter, right? It's called the redox pathway. I don't know if we talked about it last time or
No,
not.
we didn't.
So the, the redox pathway is where we were designed by our maker to move things through the human body like electrons.
Mhm,
And when these electrons move from this way to this way, this way to this way, you're making energy molecules. So the human body was designed to be in motion. It was not designed to lay in a hospital bed when you're sick with COVID and expect people to get better. And um, when you're sick, you need to get out of bed. You need to walk around a little bit because otherwise you're going to get fluid in your lungs and you're going to get pneumonia. And it killed people during COVID and kills people during the flu season every year. So we were designed to move electrons through the body. That's how we make all our energy molecules. That's how for example, we have our bones, keep our bones healthy. So if everything's working correctly in the human body, every 8 to 10 years, you get a new skeleton.
mhm,
Why do you get that? Well, just living life and walking around and, bumping into things or carrying things or, whatever you do, you're going to get old and injure bones. Bone cells get old just like all other cells of the body.
mhm,
And you can injure bone cells if you bump into something or if you play tennis or pickleball or something.
mhm,
Uh, so we have an intricate mechanism set up by our body from our whoever designed us that we have cells called osteoclasts in our bones that get rid of old and injured bone, break it down and remove it. And let's call this one removing old and injured bone.
mhm.
And we have these other cells called osteoblasts that lay down new bone.
And that's what progesterone helps with.
If everything's working correctly, this pathway is getting rid of old and injured bone and
Mhm,
laying down new bone.
mhm.
So, um, where did I get? What was the question that got me?
Inflammation. We were just talking about
Inflammation.
inflammation.
So inflammation. So we need some inflammation in the body. You need inflammation to get rid of old and injured bone.
Mhm,
Um, And you need some inflammation to stress the muscles and stress the bones so the body can get this redox pathway going. So you're cleaning up things. So when you get rid of old and injured bone and lay down bone, if everything's working correctly, every 8 to 10 years you got a new skeleton. However, go take one of those osteoporosis drugs like Reclast or Fosamax, and what they do is they poison these osteoclasts. So you're just laying down bone upon bone upon bone.
Mhm.
But now you're laying down bone upon old and injured bone and bone, just goes and goes and goes. Are you going to get thicker bones with using those drugs? Yeah, you're going to get thicker bones. Are they healthier bones?
No.
No. They're going to be more likely to get pathological fractures where you can fracture bone with a low impact, you know, either low impact to the bone or just a movement and the bone fractures.
Mhm.
For example, it is known that you get these pathological femur fractures. Your femur is your thigh bone, it's the biggest bone in the human body. It's tough to fracture that bone. However, car hits you or you get in a big enough accident or force to the bone, it'll fracture.
Mhm.
But I had I had a patient sitting on a shower stool, reach over for a bar of soap. She said she didn't slip, she didn't fall off the stool. She just reached over and heard a snap as she was reaching over, and she said she couldn't get out of the shower. Her femur had snapped. I had another patient in her early 60s who's been on Fosamax for 10 years, um, step off a curb, and she said it was a low curb. She didn't trip. It was something she does every day of her life, and she's on the ground with a snapped femur. And I have story after story of these these pathological fractures from people using these drugs who had thicker bones than the drugs, but weaker bones. So we need inflammation, but a controlled inflammation. The
Mhm.
problem with inflammation is when it gets out of control, it's like a fire burning through the body, and then nothing works well. And as a firefighter to come and put this inflammation out, the body will go into emergency mode and it'll start getting fatter. Put fat over the body because it
And
knows it's under
fluid retention, yeah.
fluid retention. It's going to get bigger. Everything's going to get bigger. It's going to hang on to things much tighter. You're not going to be able to lose weight no matter what you do in
Mhm.
this situation until you get the inflammation down. And now you got a double whammy because fat cells can produce a lot of inflammation and when they get irritated.
Mhm.
And in an inflamed body, you're producing all these hormones that facilitate more fat on the body and fat production. And then it's just circling,
It's a
chase.
vicious cycle, yeah, and you really have to break it. Most people are in a state of chronic inflammation. You can see it when you just look at people. I was in the gym yesterday and there was a woman like over here, and I'm trying not to stare because people can feel when you stare. And her face, her skin was just on fire. It wasn't even rosacea. It was just, and she was not working out hard, so it wasn't that either. But her face was on fire, and I'm like, oh, do I go over and say I can help you? Like, I don't want to overstep a line, but the term on fire, like you can visually see the body is so inflamed, it's just coming out through the skin. It was crazy. So, in your book, you have a lot of case studies. I think you've got like 40 case studies. Like, there's a lot. One that kind of caught my attention that I wanted to bring up now. Um, This woman, her name was Mary, if you remember her. In this, I just highlighted one sentence that really stood out to me because I'd love you to comment on this because I do have clients struggling with this. Basically, Mary was pleased at her progress and said, I did not realize how depressed I was until now. So you had put her on some sort of hormone therapy, and most people are very depressed and unhappy, but they would never think it their hormones.
So if you look at every single one of those adrenal and sex hormones, when they're imbalanced, depression, anxiety, fatigue, brain fog is just one of the side effects of it. And that's why that's another good example of why using them together in combination is better than using individual ones. A, you can use lower doses, which I'd rather use the smallest dose of anything that I can.
Yeah.
And B, there's a synergistic effect when you use them in combination. And things like depression and anxiety, brain fog get better, much quicker when a little bit of DHA, a little bit of pregnenolone, progesterone, testosterone. plus or minus estrogen is used along with maybe a little bit of thyroid hormone when it's needed.
What is the connection to, I don't want to kind of spend too much time on thyroid because we did before, but what is the connection to low thyroid function and depression or mental health issues?
Well, that's been written about for over 100 years. And low thyroid leads to sluggishness, sluggish brain. People don't feel good. They gain weight, they gain fluid weight. They gain this myxodematous fluid that puffs up their skin and their face gets all swollen and their eyes get swollen. They don't feel good.
Mhm.
You don't feel good long enough, you're going to get depressed, you're going to get anxious, you're going to get fatigued. It just goes along with it. That's the classical symptoms of hypothyroidism.
Back to inflammation, I always tell people if you have a lot of inflammation, especially in the gut, you are going to have a lot of mental health issues. So there was another one here which also caught my eye, and this was Jordan, Dr. Jordan, and he was talking about I find it extremely difficult to read any long books because I cannot concentrate for long periods of time. And the reason that stood out to me is because I had someone recently say to me, I recommend books to my clients in the evening as a wind down before bed instead of electronics, obviously. And she said she can't read. I'm like, why can't you read? Like, it wasn't a case of she couldn't read. She's like, I can't read books because they make me dizzy and then I get nauseous. And I'm very convinced this person has a lot of hormonal issues.
The brain doesn't work well. Look, the brain has those same receptors that the rest of the body has, and the brain is exquisitely sensitive to hormonal imbalances. Um, all these hormones can feed back into the brain. Thyroid crosses the blood-brain barrier, and there's some local production in the brain of thyroid hormone as well. And um, you know, just sort of as I said earlier, the classic complaints of hypothyroidism are, brain fog, fatigue, depression. I mean, it's been well known for, millennia.
Mhm. What is the connection between then, since as we're speaking about the brain, natural or bioidentical hormones and chronic migraines?
So my experience with people with chronic headaches, and migraines can be under that category, is the vast majority of them have hormonal imbalances. And the vast majority of those have thyroid hormone imbalances. And getting the thyroid corrected has helped untold numbers of my patients with chronic headaches from whatever cause. Um, so what I think it is when, your brain is not getting enough hormonal support or nutritional support, it creates inflammation, and the inflammation is going to manifest as headaches, and brain fog and, depression and irritability and so on.
Mhm.
And you're right on the gut-brain connection. You inflame the gut, the brain's going to get inflamed. The vagus nerve crosses into the brain. Vagus nerve sits in, the root of it sits in the stomach area.
Mhm.
And you know, getting everything resituated, particularly getting the hormonal system rebalanced, can just do marvelous things in the human body.
I know if I have like alcohol, I don't drink it a lot, but if I have alcohol or if we go out to eat, the next day I have this awful feeling of like malaise. I'm not good enough. I wouldn't say it's depression, but I just feel dysfunctional. Like I know something's off because I know my body. And I had came across a study a year or two ago and I shared it and a lot of people were shocked. And this research was basically on corn, how the consumption of corn can increase depressive tendencies. And last week I had some corn chips, and maybe it was just coincidence. I had some corn chips last week, and the next day I was like, why do I feel so off? Like, why do I feel so low in myself? And I'm going through everything in my head, and I was like, shit, I had corn yesterday. Was that it? Could that have been it? But I think I'm pretty sensitive, and anyway.
What you eat, you are what you eat. The old saying, garbage in, garbage out holds true. Don't accept to feel well, put garbage in. Alcohol can be considered garbage. It just
Mhm.
poisons the body, poison,
Yeah.
crosses the blood-brain barrier and poisons the brain. Um, I'm always encouraging my patients to eat good food, drink enough water, and keep alcohol hopefully out of the diet or down to a bare minimum.
Yeah, I think because I'm so, as they say, clean already, that when I do get exposed to these types of foods, I'm extra sensitive to them and I just respond really fast to them. One last question before we wrap up. And there's a lot of talk around estrogen now. There's definitely a big push on estrogen. I don't know how much you follow in the social media world in regards to bioidentical therapy, especially that estrogen should be the first line of therapy for women in perimenopause, which I don't agree with. But what's your opinion on estrogen therapies in general?
Estrogen is very helpful for a perimenopausal woman or a menopausal woman or a postmenopausal woman, or sometimes a premenopausal woman when her system is such a mess.
Mhm,
Um, the the female body has a lot of estrogen receptors that they're there for a reason because they should be binding estrogen, and similarly to the male body with testosterone. And appropriate use of estrogen, bioidentical estrogen, natural estrogen can have wonderful effects on the body. And um, we are in an overestrogenized society. There's all these estrogen mimics, and forever chemicals that bind to estrogen receptors, and they overstimulate estrogen. Um, but it's sort of the analogy of Provera versus progesterone. It's binding to that receptor inappropriately
mhm,
and causing an overestrogenized situation, but it's not estrogen doing that. It's these forever chemicals that are doing that.
mhm,
So again, it's sort of garbage in, garbage out. It's cleaning up the diet, drinking more water, detoxifying things, correcting nutrient imbalances, and using bioidentical natural hormones, with judicious approach and checking people. I check levels. I make sure patients get blood work a couple of times a year. There's different ways to check these things, but as I describe in my book, I think serum levels are more than adequate, and I've got 30 plus years of experience in my between me and my partners, we have over 100 years, well
mhm.
over 100 years of experience of checking these things and following people and adjusting based on symptoms and based on lab tests.
And progesterone is still the first li therapy in perimenopause before estrogen.
Progesterone's a fabulous therapy. There's little side effects with it. Progesterone levels get depleted much quicker than estrogen levels at menopausal time, and um, progesterone can help buffer that excess estrogen that's the xenoestrogens. That was the word I was looking for from the environment. These xenoestrogens, which are binding to these estrogen receptors and causing all these problems. So progesterone's wonderful. It's good
And not
for
to demonize estrogen, but I think you, and I say estrogen, you said before that estrogen or estrogen, and I've heard it in many places before, is also anti-thyroid. So if we're seeing thyroid issues already in a patient or a client, then we probably shouldn't be using estrogen first. We should look at thyroid and progesterone first before we throw more fuel on the fire.
they should all be balanced appropriately together versus using one individually. And I didn't say estrogen. You said estrogen. I said estrogen.
I say
Uh,
estrogen, yeah.
um, um,
And I
but
say iron as well.
but look, iron's really important for all these. Iron's a cofactor for nearly every hormonal reaction. So is vitamin A. Thyroid hormone is a cofactor for all these adrenal hormones. Magnesium is in this pathway, zinc, all these things. And they need to be appropriately checked and appropriately treated. And people can get rebalanced on the hormonal system and it can really make be life transforming in such a positive way.
Well, thank you for your time again, Dr. Brownstein. Pleasure as always. I'm going to hold you on that coffee date. When I get to Michigan, you owe me a coffee date.
Well, what?
Um,
Just gonna
I'll
fool
have to
me.
keep an eye out for your next event. I missed the last one because I didn't even know it was on. So I'll have to keep an eye. Whoever's doing your Instagram needs to get their act together so I know what's happening.
I will let them know.
Well, all your books, as usual, I'll share the links, I'll share your website, I'll share everything. Thank you for your time today, Dr. Brownstein.
Thanks for having me, Shemaine. We'll do it again.
Yes. Bye.